Hi, my name is Emily and I'm going to be performing some palpations on you today. So the first palpation we're going to be performing is the scalene muscles. We have an anterior, a middle, and a posterior scalene. The anterior and middle scalene will work to elevate the first rib and laterally flex the neck, and working unilaterally, which is together both of the sides, they can flex the neck as well. The posterior scalene will elevate the second rib and laterally flex the neck as well, bilaterally. And to palpate the scalenes, there are actually two different ways that we can find them. So the first way, my patient is going to be supine here, which she is already. And so I'm going to move right back here. And I'm going to laterally flex the neck to one side, just like this. And I'm going to place my hand right here, and if you can just push back against my hand. So here we can see the scalenes popping out right on the side here, and you can palpate that as this full structure. And you can relax. Another way to palpate them is seated. So if you can sit up for me and just hang your legs off of the bed. So here we can perform what's called a sniff test. So if you can just inhale really, really deeply through your nose for me. So right here you can see the scalenes popping out in that direction. And so that's another way just to identify where the scalenes are on the neck. Next, we're going to be able to find the anterior triangle of the neck. So both of the anterior and the posterior triangles just help us locate what structures are available underneath the surface of the skin of the neck. So the anterior triangle has a superior border of the inferior border of the mandible. The anterior border is the midline of the trachea coming right down here. And the posterior border is the sternocleidomastoid, which you can see coming in diagonally this way. So this would be the anterior triangle of the neck here. Within the anterior triangle, you can find the internal jugular vein, the common carotid artery, and the trachea, since it's a part of the borders. From here, we can identify the thyroid cartilage. So the thyroid cartilage is one of two tracheal rings that are right there on the trachea. So if I'm palpating very gently down from the mandible to the trachea here, I can feel the two larger rings. And if my partner would swallow for me, so I can actually feel those rings moving underneath my fingers there. Next, we're going to find the infrasternal angle. So the infrasternal angle is the angle that the costal cartilages of the ribs make with the sternum when they're coming up to connect to the sternum, right above the xiphoid process. So to find the infrasternal angle, I'm going to start at the ribs laterally here and just move immediately, finding that border all the way up. I'm going to go right under your band here. And here I find this little space that the costal cartilages have stopped, and the xiphoid process is right beneath my finger. So I'm in that infrasternal angle right there. So from here I can find the xiphoid process just by palpating it above the infrasternal angle there. Or I can start with an inferior to superior direction, moving right along the abdominal line. So I'm just going to ask you to lift your chest for me. Thank you. And I can travel right up, right in the intra-abdominal line until I can palpate that bony landmark, and that would be the xiphoid process, which is the most inferior portion of the sternum.